Thank you for joining us for the Universal Developmental Screening Pre-Proposal webinar. Today we'll be talking about the Prenatal to 5 Developmental Screening Landscape Analysis and Strategic Plan Request for Proposals. What we hope to cover is a little bit of background on what Best Starts for Kids is, a brief overview of the Universal Developmental Screening Strategy area, a brief overview of the Prenatal to 5 Developmental Screening Landscape Analysis and Strategic Plan RFP, a little bit of information about where you can find data and how to use it, and then we'll open things up for question and answer. So what is Best Starts? We'll start with the basics. The vision is that we want to see more babies born healthy, more kids thrive, and more young people grow up to be happy, healthy, successful adults. Building strengths and resilience, this is really the most comprehensive approach to child development in our nation. So how do we do it? We want to increase the good and decrease the bad and intervene whenever needed. Promotion begins before birth and throughout life, increasing positive resources, relationships, opportunities, and environments when available. Prevention is preventing things like stress, unsafe environments, or insufficient opportunities. We want to intervene early by supporting children and young people who need more resources. Policy and systems change. We believe that with this, all communities can thrive and prosper. Best Starts will invest an average of $65 million per year. So the approach for the Prenatal to 5 Universal Developmental Screening Strategy area is that there will be a biennium investment of $2.7 million. Developmental screenings will enable home visitors, child care providers, healthcare providers, and other community supports to monitor and celebrate with families developmental milestones. Best Starts for Kids will support developmental screenings that help professionals connect families to early promotion, prevention, and intervention supports and services when the child's brain is most capable of making change, and we're in this really magic window. So a few funding specifics. We'll be funding 3 phases of work through this RFP. The first phase will be a landscape analysis. And in the landscape analysis phase, we're really hoping to gather a comprehensive overview of current details and data related to developmental screening throughout King County. This would include availability, gaps, barriers, and we want to look at all things related to universal developmental screening. So training and supports for universal developmental screenings, where and how are those happening, developmental screenings that are conducted for children prenatal to 5, who's getting developmental screenings, in what way, by whom, and who's not getting developmental screenings. We want to learn more about screenings that are provided to moms prenatally and to parents after the baby's born that might impact social emotional well-being of the family. We want to learn about referrals and connections that are made for families once they've had developmental screenings, to promotion opportunities, prevention strategies if the family's at risk, and intervention or treatment options if that's a level of service or support that the family's in need of. We want to engage extensive stakeholder outreach throughout this process, including meaningful participation with historically underrepresented communities, marginalized families, cultures and communities which may not have previously been reached or well served. And we want to do this to ensure that we have an accurate picture of what's being provided from multiple perspectives. We're hoping to gather qualitative and quantitative baseline data. Stakeholders will inform us as well during the strategic planning process. So that moves into phase 2, our strategic planning process. Again, we're really looking to collaborate with the stakeholders that we engaged in phase 1 of this work to help us build a strategic plan to have a comprehensive system of universal developmental screening that meets the needs of all children prenatal to 5 and their families in all communities, to be delivered throughout all child, family, and community systems. Strategies will include positive messaging to combat misconceptions and fears about developmental screening that may exist in communities, And this will align with the King County Help Me Grow system that's currently being developed through another Best Starts for Kids strategy. Phase 3 is implementation. After completion of the landscape analysis and strategic plan, the organization who's our successful grantee will continue to work with King County and with the stakeholders that we've engaged throughout this process. Key elements from Phase 1 and Phase 2 will be incorporated into future requests for proposals, seeking community-based groups and organizations to implement recommendations from our strategic plan. During Phase 3, the organization will help convene periodic stakeholder engagement meetings to learn about the impacts of implementation on families, providers, systems, and communities. The organization will also work with the Best Starts for Kids performance measurement and evaluation team to assess progress compared to the baseline data gathered in year 1 and desired outcomes, and help us evaluate other findings and tweak things as needed. So timeline, this is subject to change if necessary, but the posted timeline is that we have the RFP, which was issued August 31st. We completed 2 information sessions, one on September 12th, which was an in-person session, and this webinar on September 14th. The final day to ask questions will be September 21st at 2 p.m. and this gives King County Procurement time to type up all of the questions and make sure that they get posted in an addendum to their website. The RFP responses are due no later than September 28th at 2 p.m. It's really, really important that RFP responses are received on time, as procurement will not pass them forward if they're received in their office later than September 28th at 2 p.m. We plan to review and rate responses between October 2nd and October 6th, and then do interviews with applicants if needed between October 9th to October 13th. There will be a notice of selected and non-selected proposals that will go out October 17th. So again, submission requirements must be received by King County by September 28th at 2 p.m. We need 1 hard copy and 2 jump drives. The narrative should be no more than 5 pages. We need a signed cover page and 1 budget. So rating criteria and process. We're really looking for applicants that can demonstrate the following experience and core competencies. We're looking for people that can commit to alignment with the Best Starts for Kids vision and goals, for commitment to King County's equity and social justice strategic plans, vision and goals, and experience working with a racial equity lens, tools, and strategies, as this is really a foundation of Best Starts for Kids. Prior experience in conducting research and assessment in prenatal supply issues or promoting systems development with young children, families, and communities. We're looking for organizations that have experience with large-scale quantitative and qualitative data collection and analysis. Really important to us that we're getting both of those elements with the landscape analysis portion. We hope for someone who has experience with meaningful stakeholder and community engagement with diverse communities. Again, we're really hoping to hear from historically underrepresented families and communities. Experience with community-based strategic planning, pre-existing relationships with some of our key stakeholders and leaders in historically marginalized communities, and relevant strategies for developing new and ongoing relationships as needed. And the capacity to balance timelines with ensuring that we're truly getting that meaningful stakeholder engagement. So data and evaluation. There's really a belief throughout Best Starts for Kids that we're partnering with community in order to gather our data, that it's truly a collaboration, and that it will be accessible to everyone. If you're interested in finding out more about data and evaluation that's available now, visit kingcounty.gov/BSK indicators. So that's all we have for today. Again, all questions will be posted on through procurement, so watch for that.